Calling to order the Winnebago County Community Mental Health Board meeting Wednesday, January 8th, 2025 at 2:00 p.m. Roll call is first order of business. Mary Ann Abadi here. Andrell Bradshaw. Here. Dr. Copeland.
Here.
Dr. Giardini.
Here.
Dr. Gorski.
Here.
Dr. I'm sorry, I was giving you Dr. DeCooner.
Here.
Margie Lindmark. Present. Tim Neighbors. Jeff Nielsen.
Here.
Dr. Penny. Here. Mohammed Yunus.
Yeah.
Welcome all. We have with us today Jason Holcomb, as along with Chelsea Glatz, Alex McCann, Emily Kate, and Seth Boswell, along with our council. I don't have Brandy Glass. So we welcome all of you here today, as well as the public. Thank you. We will now go into public comment. We have one public comment, and it is James Johns from Kikifer. Yes. And it's a 3-minute for public comment.
Very Speak out a little bit, please.
Yes, is it on?
My name is James Patrick Gaines. I'm here to speak on behalf of Kiki First Academy and just give a little bit of my testimony. I'm a former returning citizen, which means I've been in prison before. So, former returning citizen means I've been in prison before. I'm a resident of Winnebago County, long-time Rockfordian. I just want to give a little testimony of my life. So this is the mental health board. I'm a proud recipient of mental health. I was raised in an abusive household. I've been to a boys' home for tremendous years. I was in the DCFS foster care system, juvenile detention hall. I had trouble at last year around this time, on my birthday, actually coming up on the 25th, my son had passed away from leukemia cancer. A couple of months after that, my mom had also passed away. So, and during my prison sentence, yes, I would consider myself rehabilitated and reformed. I finally, learned the knowledge and the skills, how to conduct myself to be a part of society. But I was not prepared to see a 3-year-old baby dead on the slab. That's a whole another type of traumatization of going through. And also losing my mother after 3 months definitely added on to it. I'm not here today for your sympathy at all. This is unfortunate. And having a person who's been through tremendous things in the past and trying to better their life, it's very hard if they don't have those tools to do so. I'm just beginning to have all the time emotions. I was feeling homicidal, suicidal, all of the above, any mental emotion you could think of. I seen a dead baby laying on the slab. I would never be the same. In the midst of those feelings, whether it was throwing my life away or possibly taking my own life, I met Henry McDavid from Kiki First Entrepreneur Academy. And what they're trying to do is a well-needed program in this community, and I can't really speak firsthand. Henry McDavid, he took me in, he helped me learn about business, start my LLC, start to provide for myself so I don't have to choose my old habits being in the streets. He also taught me separately through mentorship about emotional regulation, emotional intelligence. unboxing the process of those funds, knowing where these funds come from, knowing the situations of why things are, even from an economical standpoint, disadvantaged communities and whatnot, and apparently that's where I come from, that's what I am. Today, I'm a survivor, like I said, I'm not here for sympathy, I'm a survivor. I'm currently enrolled in Rockland Career College for Political Studies. I have my project manager certificate. I'm a journeyman with Local 464 out of Madison. I'm doing well for myself. Like I said, Brother Henry helped me get my business and helped me get on my foot. Talking to Brother Copeland about hopefully getting an internship about I just wanted to come here and truly hope that you change your minds and help keep First Academy bring this mission program about. This is a well-needed program. And if you look at my life, please look me up, James Patrick Williams. It is a public document of my past. Yes, it's my past. I'm still dealing with the past, but I'm not my past. I'm not who I once was, and that's thanks to Keep First Academy.
Thank you. I have a statement to read. Two organizations whose applications for funding were denied through the Accelerator Award funding opportunity have filed written requests for reconsideration and appeal respectively. The board's funding policy dictates that all funding decisions are final decisions. The board has not adopted an appeal process on funding decisions because it would be impractical for a competitive funding process that has limited funding available. As such, these requests have been turned over to the board's legal counsel to provide the appropriate response according to any relevant statutes and board policies. Thank you. Okay. We have two presentations today for Accelerator Awards. One is the Youth Services Network, Transportation and Security.
Okay, well, I can see that, so I'll just try to put my stuff up here. Or right here. No, that's okay. My name is Susan Rader, and this is Erica. No, Erica Potter, she's the manager, the shelter manager for both of our shelters. So we applied for looking at transportation and security, and we worked closely. I looked closely at your strategic plan and how this fits into several areas. So we certainly support non-standardizing transportation options. We believe that it's important to reduce transportation needs by supporting the location of facilities in neighborhoods. In fact, this summer we will be providing services at the Irving Street House. We consistently offer transportation to clients. All of our services are community-based, so we are out in the community, either at someone's house, McDonald's, anywhere. We will meet people anywhere, like the library, wherever. And this is why we're looking at, this is why we're looking at other transportation options. Because when we do groups, like we have a funded program at the shelter for mental health. We have to, if we have a group, we have to send sometimes 2 or 3 staff out to pick the kids up because there's not enough room in the cars for kids. So that's why we're looking at purchasing vans. And certainly with counseling, we have group therapy, we have life skills, and we do recreational. We do a holistic approach to all of our services. And I can't read what I wrote here, so. So transportation. It isn't just Rockford and where there's pockets of poverty and there's lack of transportation. We also look at all of Winnebago County, which when I look at Winnebago County, I look at, I said in here somewhere about rural, and I think Pecatonica, Durand, and Winnebago is rural, and we do have clients out there, and we have to go get them. But we also, and they don't have transportation. Many of the families that we work with don't have transportation. And of course, Rockford and Roscoe, there's no bus service, at least that I'm aware of. And you guys might know something different than I do. But right now, as far as I know, there's no bus service from Rockton down to Rockford, like there is, you know, in Boone County with Belvedere. It's hard for families. I think the thing is what we find is how daunting it is and how overwhelming it is when you have appointments. You have to go to a physician, you have to go to your therapy appointments, you have to go grocery shopping, you might have to go to school functions for your kids. It's absolutely daunting for some of these families to find transportation to continually depend on other people. So they back away. They feel overwhelmed, they back away. And that's why I said, I think, and I've been here for 30 years, I think it's always excelled and been very creative in finding ways to get kids and families to our office, to wherever. I mean, we have, I'm gonna start joking as I go. We have several programs, not just the two that are funded by the Winnebago County Mental Health Board, but Redeploy, Crisis Intervention, several other programs that all have a therapeutic component to it. So we're providing services, we're having those, the Redeploy, the boys and girls come. Again, we're sending staff out, 2 or 3 staff, and you are a perfect example of having to pick up kids, taking them home, picking up families, teaching young moms, because they work with this program works with young moms, taking them to the grocery store, teaching them about nutrition, teaching them about budgeting, taking them to the bank. She just came from a graduation for a child, a young woman who finished her GED, and they did an honor walk at Roosevelt. So those are the things we want to be able to go to that people don't have, you know, the family.
Youth Services Network, our program services young people between the ages of 0 and 24. And we know a lot of times that particular population is vulnerable to a lot of different things. A lot of our programs are trauma informed and we're dealing with kids who have traumatic experiences. I specifically am the homeless youth supervisor, so I work with the kids who are in the shelters, boys shelter, the girls shelter, and in our mental health review program. So we do have a transitional living apartment building. And because we know through history that a lot of this particular population, those who've experienced, a lot of times they don't respond well to traditional therapy techniques. And so we, like Ms. Sue said, are meeting them where they're at. And so it isn't just sitting in a room at a couch, you know, tell me all the gory details about the trauma in your life. It's more about, you know, let's meeting them where they're at. And let's, you know, walk around the park. Let's go to McDonald's. Let's do those sort of things. And so getting them to and from those different activities is vital in order to meet them where they're at. We do also recognize that this particular niche of young people respond very well to peer group support. And so we do offer peer group support sessions where we're trying to get them to identify alternative ways to address and deal with their traumatic events and getting them exposed to different things that are out in the community in the Rockford area or the Winnebago County area. As an example, I have over the summer, this past summer, we had a time where we wanted to take all of the girls and like children and our clients in MH4Y over to Alpine Park to go swimming. And we had a group of 12 kids who wanted to go. And when we're talking about kids, and some of them have minor children, so we've got infants, we've got 1-year-olds, 2-year-olds, and we're talking about car seats. And so we literally took 7 staff in their personal vehicles along with YSN. We already had a small minivan, so we had to transport them in 7 different vehicles to get those 12 kids and their minor children over to Alpine Pool to enjoy just a couple hours of swimming. So that's just one of the examples that we had. We also have had experiences where, because we service people who are coming from outlying areas of Winnebago County, they aren't familiar with public transportation. And so getting them to learn how to ride the busing system is not only a challenge, but this particular group of young people, their immediate gratification, where they're at. And so they're used to Ubering and lifting and getting there fast. And, you know, as we're teaching them how to access public transportation, we're having to be mindful of the idea that it can sometimes be traumatic. I have a young lady who learned how to ride Rockford Mass Transit, and while she was out in the community learning how to ride those buses, she formed an unhealthy relationship and found herself in a vulnerable situation and is now undergoing therapy for a sexual assault as a result of the relationship she developed with the person she met on the bus. And so we have to really make sure that we're not creating more trauma on top of the trauma that already exists. And so we're just hoping to bridge the gap and try to find some healthier ways to get them to and from the various appointments that they have so that they can be successful in teaching them how to navigate these things going forward. We recognize also that we're not going to be able to sit with them forever. Our program only goes until they're 24. And so we want to be able to teach them alternative ways, if it's public transportation, if it's Ubering, if it's lifting, if it means that we are helping them to get engaged in driver's ed classes. You know, those are all things that we're working with and teaching them, but we want to make sure that we're doing it in the best way and most feasible way possible.
Yeah, no, that was it. That's what she said.
So you would just consider us for the possibility of having additional funding for safe and reliable transportation for our clients. Our goal is to make sure that we're meeting the needs of the clients that we serve.
Any questions, additional questions?
The money would be used for 2 vehicles?
The purchase of 2 vehicles is what our goal is.
Okay, do you have staff and funding for insurance and maintenance and?
We do. All of our staff at YSN are licensed to drive. That's a part of our requirements for all of our staff, and so they're licensed and insured. But YSN also carries full coverage on the vehicles.
Thank you.
Mm-hmm.
Yes.
Well, trailing on Chief Nielsen's question about the liability, I remember reviewing your project. Thank you for what you're doing and what you're trying to do. My mind did go to liability and risk because you're driving people around, you're mentioning car seats, I mean, to me, there's a significant liability to transporting people in the event of something bad, an accident, the child is not in an appropriate seat. Can you explain and give me a little more comfort that you have all of those bases covered?
Sure. We actually, because we also have one of the programs under YSN's umbrella is our responsible parenting program. And so as a part of that program, we do teach car seat safety and making sure that clients know their responsibility as far as making sure that they have their child securely safe and secure in the cars. With our insurance, all of our clients, when they are involved in our services, they actually are signed up and sign off on any sort of liability as far as, you know, us being legally responsible for any harm that may happen to their children while they're being transported in our vehicles, but our insurance will cover the basic cost of any sort of medical care that is associated with any sort of accident.
The other thing is we're DCFS licensed child welfare agency, and so we have to follow the DCFS guidelines as far as, you know, you make sure driver's license are current. So we're we have HR who's always checking that, making sure that their insurance is up to date, our staff. So that's just a given. And of course, you know, they have to carry so much insurance, whatever's required. And then, of course, YSN carries, you know, our own insurance for that also. So we have a lot of, we have DCFS, we have DHS, a lot of places that say these are the rules, these are what you have to follow, or you cannot do this. And so we try to be really good and do it.
Great, thank you.
Anybody else? Okay, thank you very much.
Thank you.
Next for presentation, for an accelerator award is Live for Lolly, the Mobile Harm Reduction Outreach Program and Recovery Services.
Good afternoon, everyone. Can you hear me? My name is Laura Fry. I am the grateful executive director of Live for Lolly. Thank you for the opportunity to showcase one of our programs, which is our mobile outreach. Sorry. You know the next one. Am I, oh, do I do that with this?
Yeah.
Yes, yeah.
I have to multitask. Okay, so why did we start mobile outreach? In 2017, we did a 6-month pilot because we were finding that people were not walking into our office. And we knew that there were a lot more people with substance use disorder, with mental health crisis, with needing peer support that were walking into the office. So we did a 6-month pilot, which showed us that mobile outreach works. So we sought out funding, we were able to obtain funding, and we launched our first vehicle in February of 2020. And I have to say, it's been almost 5 years, and this has greatly increased our capacity to serve and to bring necessary resources to the public where they are. So why Winnebago County? Live for Lolly meets people exactly where they are in their communities with empathy and compassion. Our director of programs spent 6 months working for another organization here in Winnebago County. And what he saw was a lot of need, not just here, but everywhere we serve. And upon further investigation, we found that there's a lack of harm reduction being provided in Winnebago County and a prevalence of overdose and substance use in the area. So what mobile outreach does is provides on-the-spot resources and connection to services, immediate. There is a very small window of time when someone comes up to you and says, I'm ready. Gotta be there in the moment. And I can't tell you how many times we have had someone come up to our mobile outreach unit seeking treatment, and we were able to leave with them immediately and get them the services that they need. That's fine.
Yeah.
Oh, so sorry. So how do we identify communities we serve? Many different ways. Oftentimes it is requests from law enforcement, requests from hospitals, requests from other nonprofits. But we also look at the data. And if there are communities that are underserved or otherwise have limited resources and also have a high prevalence of overdose, fatal and non-fatal, those are the areas that we think we can provide the most help. We have been in our Rockford office a little over a year, and we are continuously working to connect with other entities that might have some of the same service provisions that we have that we can complement. These are some of the organizations that we are consistently involved with. We provide weekly tabling at several locations where we have supplies, we have Narcan, we have test strips, and all of our people are peer recovery support specialists. Kind of breezing through this, so there's room for questions because I know that you all have this. So what are some of the services that we offer currently in our mobile outreach locations? Not necessarily what will be offered here, because every area that we service is unique. So Oak Park is not going to look like Maywood, it's not going to look like South Park, it's not going to look like Winnebago County. So we do tweak depending on what the needs are. Typically, we provide what's asked for if it's possible. The last month, with the onset of the cold weather, the things that we've been getting out the most, hand and foot warmers, hats, gloves, scarves, socks. We took up a collection of new coats and boots, and those go like that. In the summertime, it's t-shirts mostly. So what are some of our anticipated outcomes? Every time someone comes up to our mobile outreach unit, we give them a card with a unique identifier. We keep track of a lot of data by this unique identifier. So we would be able to tell you age ranges of people that we are servicing, how they identify gender, race, and age. But it's all by a unique identifier so that we keep people's identity private. And our anticipated outcomes really are pretty simple. Any positive change. This could be using clean supplies. This could be obtaining naloxone and learning how to use it. Using test strips to test before they ingest. Repeat visits. When someone comes back to our mobile outreach unit, that indicates trust. And that's one of the first hurdles that we have to get past is trust. Once we build trust with people, then we can help them. It's also really good to get reports back from people when they've used the naloxone that we've given them to save a life. This is our team here in Winnebago County. We have Will, who's the program manager, Melvin, who is our recovery navigator, John, who is a harm reduction outreach coordinator, and where is our Marissa? These are all people that not only live here currently, but they have lived in Winnebago all their lives. And this is how Winnebago does. When we service a new community, we hire people from that community. Oftentimes, they're former participants who have come to us for services, have gotten well, and then we can train them and hire them. Who's our target audiences? It's really pretty broad. Obviously, people who use drugs. The people who love people who use drugs. Professionals, we have a lot of relationships with medical providers, addiction doctors, mental health providers, and then townships and municipalities. Currently, Winnebago is serving 8 counties. We are here in Winnebago Boone under a grant from the Substance Use Prevention and Recovery Division of DHS. Mobile outreach is just going to enhance the amount of people that we can help. some of our marketing messages, and how do we get the word out? How do people know that there's a mobile outreach? We utilize a lot of different methods. Social media is obviously a big one. We put out flyers, we put up billboards. We have signs currently in Rockford at bus stations, or what are they called? You know what I mean, shelters, thank you. We also reach out to therapists and mental health clinics and healthcare facilities to let them know that we're here, and we are always at the same place at the same time on the same day. Consistency is important. These are some of our marketing strategies and how we approach marketing, because what good is a mobile outreach or any outreach if people don't know you're there, right? This is last year, what our mobile outreach was able to do. We currently have 6 mobile outreach locations. We served 8,333 people. Gave out over 21,000 doses of naloxone. That's 21,000 potential lives that are still here if it was used. 169 people navigated to treatment. And we pulled some numbers for our Rockford office. In our Rockford office last year, we saw 722 people and distributed 3,236 doses of naloxone. So you can see what mobile outreach can do, how it can expand the capacity and serve more people. And it is part of the data that recently came out from the coroner's office. Community-based naloxone distribution saves lives. That's just a fact. This is just a legislation that allows us to do harm reduction outreach, both mobily and in fixed locations, just for your information. And that is our truck. That is not what this one will look like. It actually can look like whatever the mental health board wants it to look like. But that is our stigma crusher. We added a second vehicle just recently through a private donation, so we now have 2. And we'd like to add a third to provide more services and to reach more people. And that's that. What questions can I answer? And I have to preface, I am hearing impaired, so trying to hear someone in this room is difficult, so I apologize. I might bring my ears up here.
Questions?
Oh, sorry.
Okay, Jeff.
Got a couple. Earlier on, you said you can provide instant services. Someone walks up and says, "I'm ready." How do you do that? Because getting in instantly in a lot of places is difficult.
You know, that comes from doing this for 15 years. We have a lot of connections. How many times have we driven from Rockford to Haymarket in the city?
Numerous.
We will find a place. And that doesn't always mean inpatient treatment. For example, someone that came up to the truck when I was in Waukegan had their electricity shut off. And she didn't know what to do, and she saw the purple truck as the helpers. So I took her to the township and helped her fill out an LP. You know, it's just knowing who you know, having the connections, having the resources. And if we can't get someone into inpatient treatment, we'll get them on medication and we'll get them in an outpatient program. That can happen right away, most of the time. And we also have peer recovery support specialists that can do one-on-one until we can get them into a more permanent inpatient situation.
You also mentioned legalities in different communities. Legalities in this community, the elephant in the room is needle exchange. Where do you stand on that?
And I'm sorry, could you repeat that? Not all of it, I didn't hear the middle part.
Okay. Where do you stand on needle exchange in this community?
We follow the rules of the community.
Good job.
In the city of Rockford, we can give out all supplies except for syringes. I do not know what it is in Love's Park or Pecatonica, anything like that. I have learned that individual towns' law supersedes state law. So even though we are, there is a state law that protects us, we have to abide by what the community needs and wants. And we do.
One more.
Sure.
$210,000. Can you break that down easily?
Scott, where are you? He's actually online, that's our finance guy. Typically, a vehicle that we purchase is between $60,000 and $80,000 depending. And then you have to outfit it, you have to wrap it. There's insurance, there's maintenance. That is the best I can break it down, and I apologize if you wanted to ask specific budget questions. I know that Scott's on here and I don't know if people online can talk.
I don't think he's actually in the Zoom meeting, we might be just watching on YouTube. So
Oh, gotcha, okay.
So I don't think that'd be possible.
Can I send you the budget? Would that be helpful?
You can send it to the board if you wish.
Absolutely.
But following up on that, you're maybe at 100,000 with a vehicle. There's another 110,000 out there somewhere. That's what I was asking about. On numbers, you mentioned last year you had 722 clients. Was that in 24 or 23?
24.
24.
We've only been here a year.
Your application talks about 2,000. How do you anticipate that growth?
I'm just looking at the numbers that we do every year. It will definitely, I mean, that's 1,300 more people when you're doing mobile outreach. Typically, one of our sites currently sees between 60 and 100 people. We have 6 sites that we go out to. So if you average that, at 3 sites in Winnebago County, at 50 to 60 people a week, I think we will far surpass that.
And how many hours a week is that truck available to the residents?
That will be open to the need. You know, if we go out one day a week and we're overloaded, or someone hears about us and says, hey, we want your truck over here by us. You know, I mean, we started out with 1 location in Waukegan, and 3 years later, we were at 8 locations. So it grows depending on the need. And the times are different too. You know, also depending on the community. One of our locations, we do between 4 and 8, because that's when the community is there. You know, we're very flexible. We are not a Monday through Friday, 9 to 5. So it depends on the need.
Here,
Okay, my question is, on paper and presentations, everything always looks good, okay? But in reality, you said you served over 8,300 people last year. If you can come up, what kind of percentage of people were you successful with?
How do you measure success?
Well, that's what I'm gonna ask you. How do you measure success in this? When you have over 8,300, what people are you saying you're really helping?
Every single person that comes.
So you're saying you have 100% success rate?
As I measure success, yes.
How do you measure it?
We measure success by any positive change. If I can get an IV user to use an alcohol pad every time before they use, success. Absolutely. Stops the spread of disease. Repeat customers, people that take naloxone and then come back and get more because they used it, success.
I'm having a hard time with that, okay? I mean, I appreciate what you're saying, but I'm having a hard time with that one.
So tell me how you would measure success.
I'm not in their program. I'm not in there. So that would be very difficult for me to come up and say something like that. You're in the position, I wanna know how you're measuring it. If you're saying 100%, and that's how you call 100%, fine. That's on you. That's on you. And like I said, everything looks good on here, presentations, proposals, but I wanna see how it goes in reality. That's how, because when you're asking for that kind of money,
Yeah.
I wanna see where, prove it to me.
Well, we measure any positive change.
Okay, all right.
And it's not, I'd say that at least half of the people that come to our current locations are coming for toiletries, food. We serve a lot of food deserts. There's places that say we are their only source of fresh fruit. Half of the people that we see are not substance users. They're people who just need help. And I don't know, do I measure success by people eating fruit instead of junk food? Yeah. And just that connection, the connection. How do you put a success rate on earning someone's trust and having that connection? And the impact that it has on an individual to be treated with dignity and respect and compassion. How do you measure that? That's the important stuff for me.
Yeah,
One comment following up on Terry's question and then a question of my own. I understand you're in the crisis business by what you're doing. So and I understand your point about an alcohol pad before. And I understand that. To me, success might look like how many folks do you encounter? Are you able to navigate into a long-term sustainable pathway to sobriety? So how often can you make the connection between your crisis intervention to somebody getting into long-term sobriety? To me, maybe that's a little bit where you were headed, but it's where my mind went with that. Not necessarily looking for an answer, but to me, that would be a real outcome measure of significance.
And I totally get what you're saying. Unfortunately, our services are usually sought out when people are in a crisis. They don't seek us out when they're doing well. And that's kind of pardon my language, a half-assed way of measuring success when you don't hear from someone. But that's how it works out. People only reach out to us in crisis.
And my only comment to that would be, but you have them in that moment. Yeah. And it's a moment of potential clarity for that person.
Absolutely.
Where you have a window of opportunity to refer them and get them going. And obviously.
And we do. You were talking about long-term, and we usually don't hear back from people after they're stable.
Yeah. My second question, and I put it in my response to your application, you have an extremely robust list of collaborators. And and you mentioned it a little bit in your presentation, but I'm wondering, just for clarity, which ones of these do you have some sort of formalized, solid relationship with versus a tangential relationship or even a hypothetical relationship with? Because you have everyone from the county to the mayor to health systems to Crusader so that's an awful lot of organizations. And if you
I think we need so much more. That's not a lot to me.
I'm wondering about the nature of those, and I'm not asking for chapter and verse on all of them, but it seems like that's such a broad list of collaborators. I'm just wondering are some of them in there people you've been in discussion with rather than someone you have an actual relationship with?
Yeah, I can go through that list. Rosecrans is at our office once a week to provide peer support services. Once a week, you're at Carpenter's Place and Jubilee Center and the Northern Illinois Food Bank. Oh, and the Rockford Housing Authority, we do smart meetings there. Help me with the rest of them.
You guys, we work with. They call us something we work with.
A lot of that are resources. People will reach out to us when they don't know what to do. But there's 1, 2, 3, 4, 5 on that list that we provide weekly services to.
Okay. Thank you.
And I don't think that's enough.
Staying
We're
on
working on that.
that, staying on that same note, just out of curiosity, the relationship that you have or don't have with LP Johnson, since they are involved in addiction medicine, is it, how tight are you with them? How much work have you done with them?
So one of the providers is actually on our recently created local advisory board. That we've had one meeting with, and we have one come.
Okay. Do you work with memorandums of understanding, or is it?
Yeah.
Yeah, we have a lot
Okay.
of them now.
So these relationships are in fact formalized?
Yes.
Most of it.
Okay.
But we are in the process of trying to determine how and what it looks like.
Okay,
Some.
all right, thank you.
Yes,
If you were able to secure money in Winnebago County, would that funding stay in Winnebago County? Or do you use for other places?
No, we need mobile outreach here in this county. I can guarantee you that.
And on that, just really quick, I got some clarification from Scott too, he called. The ask for our, what we're asking from the board is, I believe 73,000. To
210. Didn't I say
the
210?
budget, the ask from the board is 73. The supplementary funds, that covers the other 210, would be from our super grant fund.
All I'm looking at is for $210,000.
That is what it said, yes.
That's what you filed with us.
I was just told that that's not exactly accurate.
Yeah, that's why you really threw me, and I was like,
Because I don't want to speak for the board, but then there's gotta be a correction here because that's $140,000 difference from what.
Sure.
no, we really just wanted a vehicle because we have funding to be here. We just wanted a vehicle.
And I believe the breakdown was, that we would need 73,000 to get the vehicle, and then the rest would show what we already have to support that vehicle.
I understand what you're saying, but I don't understand what I'm saying too, is that what
It doesn't
the
look
board
that way.
has,
And I didn't see
yeah,
that.
what the board has apparently is not correct.
Sounds like it, yeah.
We need a revision.
right.
I think if I could just add, I think then, on this point, the gap between the 73 and the 210, you mentioned that that it would be supplied by other grant sources. So one thing, I think the other board members would most likely agree that we become concerned with is funding something that was the question at the end about sustainability in the application, that we fund something that doesn't have the sustainability to be executed. So the 73 may be one thing, but the reality of getting the other additional funds to actually bring it to fruition, that becomes important. Personally, I'll say to my judgment on a project. So that may be a revision or a clarification maybe that would be important.
Okay.
Yeah, our super grant, that we've been working under, this is our second year, is 500,000 to work here in Winnebago County.
So that is secured.
Yes.
It's not that you're applying for.
No.
Okay,
No.
that's
We got
that's a
Winnebago,
clarification,
King,
okay.
yeah.
Thank you.
No, that is secured. year. We just want to add services.
So I think we need a revision.
Thank you.
Thank you.
Thank you.
Appreciate it.
All right. Thank you very much. Moving on to the monthly activity report. Lucy?
I'm happy to report that the site visits have been completed for the renewal. The current core programs are under one-year contracts that will be up for renewal. So that will segue nicely into today's action item regarding the notice of funding opportunity for sub-programs. And the thing I'll just note as an activity update, but also forward-looking, is that we do have the first working prototype of the data dashboard that we had shown you and received feedback. We had also presented that to other stakeholder groups and received feedback from them, have made some updates and changes to make it more user-friendly and informative. We'll be rolling that out over the next couple of weeks in terms of integration with the website and then potential press release for that. So we'll be sure to share that with all the board members when that link is available for you and start promoting it.
Okay. Moving on, I will need a motion for the minutes from the December meeting, or I'm sorry, December meeting. So, okay. Second, thank you very much. Any corrections, additions? Hearing none, this is a roll call. The vote is, okay, all those in favor, please say aye.
One abstain.
Yes?
Wasn't here.
Oh, you were listed as being here. Yes. No, you were absent and it shows that.
Abstain.
Oh, you abstained. I see what you said. I'm sorry. I thought it was a correction. So, all right, very good. Moving on to the first resolution, 2025 X1, resolution authorizing audit waiver for program year 4. Jason, do you want to summarize any part of this or?
Sure, I will. So the mental health board's financial policies, which we review and update annually essentially before the notice of funding opportunities go out, and that kind of governs and dictates at a high level funding programs for those next years. That does require all funded programs to have a professional financial audit done on an annual basis. There has been a change to the state law that has reduced the state threshold that would trigger the requirement from a statutory perspective of having a professional financial audit. And some of the recent local data in surveying nonprofits has shown that those costs have gone up significantly for professional audits. So one of the organizations that would now fall into that lower threshold that would not, from a state statute requirement, require a professional audit, but rather a professional financial review, has requested the waiver of the audit to have a professional financial review instead. And that is Northern Illinois Center for Nonprofit Excellence. And that information is attached, and Pam Clark-Reidenbach is here from that organization to answer questions should you have them regarding the request.
Any questions? We'll need a motion for approval. So moved.
Second.
Very good, thank you. Any other comments? Hearing none, all those in favor, please say aye.
Aye.
Thank you. Moving on to resolution number 2025 X2. This resolution authorizes emergency funding for program year 4. The supporting items is Marshmallow Hope, a nonprofit organization requested emergency funding. And at this time, the Winnebago County Community Mental Health Board approves the emergency funding for the FY 4 to 6 funded program set forth below. The project name is Youth Suicide Prevention. The award amount is $245. The emergency condition, the awardee experienced a recent event that highlighted the need for enhanced security measures in order to ensure protection for staff, clients, and facility. The expense changes include increase by $31,500. So this will also need a motion for approval.
May I just add some commentary? So the award amount is the current core program funding amount. That's the $315,000.
That's correct.
And that contract dictates the ability to request up to 10% of the funded amount in case of an emergency that would otherwise impact the operation of that program and potentially stop the operation of that program.
Jeff?
A comment, I don't disagree with the need. The need, by what happened, that was obvious. This board deals with a lot of organizations who may be facing a similar situation. I just want throwing this out as food for thought, that alarms and security systems may be needed by a lot of our grantees. So just an awareness, this may be the first of many, assuming we approve this. Just toss it on the table for discussion.
So what you're saying is that we do one, we gotta do for them all.
Well, we may,
Yeah,
we may, I mean,
well, it makes sense, sort of, but then if we're gonna open the door on that, what's gonna happen next?
and the issue they raise is a serious one that we all face every day, is security. This building has security. Everybody, there's a lot of it going around, so I'm just saying, next month or in 2 months, we may see someone else coming in, just an awareness that this could be the opening salvo for a lot of fun.
Right.
And I'm not saying I disagree with it, it's just an awareness, is all I'm saying, for discussion.
I agree completely with the comments. I think the other mitigating thing for me would be some statement, and I'm reading right now the letter in support of it and understand the situation is very concerning. Would be some other detail about the inability of the organization itself to internally fund that. So some more detail about our current financial situation. We can't even pivot one category of funding into this, and I'm not suggesting that this organization can, but even into the future, if some other organization comes forward, it would be imperative, I think, for them to explain why they can't internally fund that themselves.
There is somebody available from that organization today to answer questions if you have one.
Right.
To respond to that.
Hello, I'm Laura Kane, founder and executive director of Marshmallows. To answer your question, we're a brand new facility this year, right? Offering intensive outpatient services as well as outpatient counseling, and then we have a partnership offering mentorship and family peer support. Our allocated funds, because it's year one, we're trying to work on the sustainability of the organization. So we are seeking these additional funds, not that we couldn't fund it, right? But if we were to fund it, we would have to reallocate funding from other line items that take more precedence to be able to service our clients' immediate need while we're trying to build sustainability, since this is year one. So that's why we're seeking your help to be able to do this.
Thank you.
What's your current security system infrastructure look like?
The only thing we have is an alarm system for the building. When we vacate the building, that's it. We can arm and disarm. But as far as, it's an open facility, there is no security. We have no cameras, we have no locked doors, and with the situation that occurred, it's detrimental that we provide that type of protection to the clients and our employees.
Up until this incident that recently occurred, that what you currently had was sufficient, it's just that this has kind of highlighted some inadequacies?
Well, we actually had, we planned for this prior to, right? Because we thought that it was needed and we actually applied for an accelerator, and were denied at that time. We had, I don't really know I believe it's because we had already been approved for for an accelerator grant, so we couldn't apply for a second. So prior to this situation even occurring, we were planning for this need. Like, we saw that this was something that our entity did need. But then we had that unfortunate event where now we really need to do something.
Are you saying you have future plans and funding set aside for this?
No funding set aside for it, no. We, as an organization, my board and I have been trying to really look into, prior to this particular situation occurring to us, we've been looking to see how we could secure this building, because we knew that the safety of our constituents or our employees could be at risk at any given moment with the security system that we have in place, non-existent. Does that make sense? And so, we had tabled that need as not a priority until that event occurred. Then we went back to okay, how can we get funding? And the only way that we saw it, or that we see this possible, is through the emergency funding that's available through the grant at this time.
Okay,
Be approved.
okay. A second for this?
Second.
Okay, and this would be roll call for this one. Okay. Andrell Bradshaw.
Nay.
Pardon me?
Nay.
Nay. Okay, Dr. Copeland?
Aye.
Dr. Giardini?
Yes.
Dr. Gorski?
Yes.
Dick Kunert?
Yes.
Margie Limmer?
Yes.
Tim Neighbors? Jeff Nielsen?
I don't like Terry on this one. I see the need, I understand it. I think there's somewhat of an expectation on their part that they're gonna receive this. But I think we have to be cautious as we move in the future. Having said that, yes.
You're a yes?
Yes.
Okay. Dr. Penny?
Nay.
Mohammed Yunus?
Yes.
Yes. Mariana Abadi, yes. So this motion does pass.
Thank you very much.
Okay. Okay, moving into resolution number 2025 -X3. This resolution authorizes Winnebago County Community Mental Health Board funding and allocation of special project funds for accelerator award applications. The Winnebago County Community Mental Health Board shall fund the following proposals after review of the application. Crusader Community Health. The program name is Crusader New Behavioral Health Access Point, and it's for $490,000. In section 2, the Winnebago County Community Mental Health Board shall not fund the following proposals after review of the application. Sounds of Good, News, Speak It, Sing It video project. The request does not align with the strategic plan. Okay, so we do need a motion for approval of the funded program, and it's a roll call. Do I have a motion for the funding of Jeff? Second? Andrell? Okay. Roll call, here we go. Andrell Bradshaw?
Yes.
Yes. Okay. Dr. Copeland,
Yes.
Dr. Giardini,
Yes.
Dr. Gorski,
Yes.
Dick Kunert,
Yes.
Margie Limmer,
Yes.
Tim Nevers, Jeff Nielsen,
Yes.
Dr. Penny,
Yes.
Mohammed Yunus,
Yes.
Mariana Abadi, yes. Okay. And then resolution number 2025-X4. This resolution authorizes Winnebago County Community Mental Health Board Accelerator Awards preliminary review determination for applications received. Okay. The Winnebago County Community Mental Health Board is willing to evaluate and explore the following accelerator award proposals. Winnebago County, the program named Juvenile Detention Center Counseling. Connections Therapy Center, the program named Community-Based Mental Health Medication and Therapy for Indigent Children, Adults, and Seniors. Swedish American Health Foundation, program named Trauma Informed Care Initiative at UW Health in Northern Illinois. And NAMI Northern Illinois, program named Foundations of Change, creating our first accessible office for community support. And the section 2 states that the Winnebago County Mental Health Board County Mental Health Board is not willing to review the following proposal due to one or more reasons causing ineligibility for funding. Family Counseling Services of Northern Illinois, Social and Emotional Learning Program. It had no value in perpetuity and not aligned with strategic plan. Northwest Community Center, program named Thriving in Winnebago County, is not aligned with strategic plan. Alignment Rockford, Strong Families, Strong Schools, Strength-Based School Family Partnership, not aligned with strategic plan. Zion West Enterprise, program named Resilient Minds, Community Education and Healing, not aligned with strategic plan. Jackson Charter School, Mindfulness Campus and Restoration Project, not aligned with strategic plan. And City of Rockford Health and Human Service Department, the HEART, which stands for Helping Early Learners Through Advocacy, Recreation, and Therapy Initiative. And it is not aligned with strategic plan. So I will need a motion for the approval to review the programs as cited.
So moved.
Okay, I need a second. Terry?
Yeah.
Good second, okay, very good. So this does not require anything but, all those in favor, please say aye.
Aye.
Opposed, same sign. Thank you. And moving into Winnebago County Community Mental Health Program Core Program Funding Renewal for program years 5 and 6, non-competitive notice of funding opportunity. So it's quite a list for programs.
Those are just the programs that are eligible to apply.
Right, do I need to listen?
Kind of.
Okay. Winnebago County Community Mental Health Board Program Years 5 and 6, notice of funding opportunity. Boys and Girls Club of Rockford for their social emotional skill building severe emotional disturbances services. The City of Rockford Health and Human Service Department, Impact, the Integrated Mobile Partner Action Crisis Team. Lifescape, the Senior Mental Health Program. Marshmallows Hope Nonprofit Organization, the Youth Suicide Prevention Program. Prairie State Legal Services for Winnebago residents with mental illness. Shelter Care Ministry, Jubilee Community Outreach and Housing Stability Program, the University of Illinois College of Medicine, Rockford, Clinical Learning and Education in Addiction, The University of Illinois College of Medicine, Rockford Merit, the Medical Evaluation Response Initiative Team, Enhanced Services and Community Prevention Education, Winnebago County Health Department, the Trauma Informed Community Care Coordination, and then Winnebago County, they have the Juvenile Detention Center program, reducing isolation through expanded behavioral health continuation, the Juvenile Resource Intervention Center, behavioral health continuation, the Resource Intervention Center, behavioral health continuation, and then Youth Services Network, the mental health for the homeless youth. Those are the programs that are eligible to grant. So, is this, do I need, is this an action item as well? Yes, I need a motion for approval. Mohammed, okay, and second, and Rob,
Discussion.
Yes.
Good question.
yes,
Am I correct in assuming, based on Greg's question for you, that these are programs that applied for multi-year during the last cycle, but were only awarded the 1 year?
Correct.
Because when you get to the end and you describe they can now receive a 2-year.
right,
So this goes out to them, for them to now submit back to us a fresh new application. I'm just wondering if we could be certain that they address in the new application, whatever the concerns were that led to only a 1-year grant rather than a multi-year grant, very specifically, if that's possible. It's somewhat selfish on my part, rather than trying to come through and figure out, well, what did we say last time that caused us to only award 1 year rather than 3?
We can go back and look if there were specific concerns, but I'll say that the large majority of them were because they weren't operational, fully operational yet, was hiring issues and or in some cases, they had just gotten a 9-month grant the year before, so they were like barely been starting by the time they opened up. But I don't think it'd be a problem for us to go back and look if there's any specific notation of an issue with an organization to bring that to their attention and ask them to address that in the proposal.
That'd be great, thank you.
okay. And just for information, I think, which is helpful, the Winnebago Community Mental Health Board will be using the Google form to be accessible starting January 8th of 2025 and will close February 19th of 2025. So that's information that's valuable for those applying. So I will need to, we did have a first and a second.
Right.
All right, so all those in favor, please say aye.
Aye.
Opposed, same sign, okay? There are no discussion items that I have listed or other matters for that.
It's on you.
Okay, but wait, Jeff did have something.
Equipment. On the application form, we have, after 4 questions, it says proposal description. Some of the applicants go into a really, really long description of what they're gonna do. A couple of them, for me, were a little confusing. Could we put before that, have them put in a 2-sentence what they want to do, and then go into a long explanation, if you follow what I'm saying?
Are you talking about for accelerator or for the renewal applications?
Yeah.
Which is like the accelerator?
So, just a very, very brief.
Yeah, we'll bookmark it for future funding cycles. The resolution that was just approved was the rest of the accelerator
Right.
awards, so we can't make that change now, but we always, I think even after the accelerator award project, probably what we'll do is engage each of the board members to get your evaluation on how those applications were for you, so we can do continuous improvement on future applications, but certainly let's bookmark that comment and make sure that's included for future funding cycles. Thank you.
I think I'm done for today.
That's great. No, I appreciate all the input. Okay.
Good question.
We have
Motion to adjourn.
and we need a second. Do we have a second here?
Second.
All those in favor, please say aye. Aye. Thank you all.